You're muted, Madam Chair, in case you didn't know.
Sorry. Can you hear me now?
Yep.
All righty. Looks like we have one more minute, so I'll wait till I know that I have everyone here. And I'll ask the board secretary to keep me apprised.
Hello, Ms. Kolkmeyer, Ms. Wachel, Dr. Bedell, Mr. Wasserstrom.
Hello, everybody.
Ms. Williams.
Hi, Doc.
Dr. Wilson.
Hi, Nate.
Hello.
So June, can you give me a sense of who I don't have with me yet?
We're waiting on Ms. Cortez, Dr. Jones, and Ms. Wolsey.
Okay, I'm going to give it a few more seconds, but I do want to start on time today. I know we have a very tight schedule. We're excited to have this opportunity.
Ms. Wolsey is joining by cell phone.
All right, that sounds good. So I have two individuals on the board who are still not present.
Correct. That's correct.
We're not voting, right, Patty?
No, we're not voting. It's a discussion for the next hour, and this meeting will be held to 1 hour to accommodate other people's schedules and obligations.
Okay, then I'm gonna mute my camera.
All right, thank you. So it is now 3:01, so I'm going to go ahead and call this meeting to order. Will the secretary please call the roll?
Mr. Abarca?
Present.
Ms. Cortez?
Here.
Mr. Hogan?
Aye.
Dr. Jones? Ms. Banser?
Here.
Mr. Wasserstrom?
Yes.
Ms. Wolsey? She's not here yet, but she will be.
Okay. Thank you. It looks like we've got our quorum, so we're going to go ahead and begin. We are very pleased to have this opportunity for this conversation with Dr. Bedell and his team. This is an opportunity for us to receive an update on the KCPS reentry plans for our school system. And we will start with discussion from Dr. Bedell and his team. And we want to provide ample opportunity for the board to ask questions. So thank you everyone for joining us today.
All right, thank you, Madam Chair. So I just want to start off by, first of all, saying hello to all of the board of directors, faculty and staff, and any of our guests who may be listening in. This is an opportunity for us as the administration to give you all the most current and up-to-date reopening school plan as we prepare for March 15th. We're very excited about where we are and the amount of work that has been done. We put a lot of work in during the first semester and even at the start of this second semester to get to this point where we feel that we have a very compelling plan that we think would help ease anxiety. We have a lot of people that have a lot of concerns right now, and you should. And I'm not asking you that that you are to get rid of those, or even that this presentation will help get rid of those. What I do hope is that as a result of us going through this presentation, it will reduce your anxiety level, that the district has taken into full account the safety and well-being of our faculty and staff members as we work to move forward with reopening school. So we're going to have a number of our faculty and staff members that are going to speak today in areas respective to them. Dr. Shepard's going to pretty much cover about the first half of this presentation, since a lot of this deals with what needs to happen inside of our schools. But then I also want to make sure that participants and people who are listening understand that on next Wednesday, we plan to roll out and do this full-blown presentation for the entirety of the community. But we will also be able to listen and take some of the suggestions and concerns that may be addressed here and make sure that that's embedded into our final presentation that will be presented to the board on Wednesday. And then negotiations, we have tomorrow to do our final day of negotiations. We're hoping that we'll be able to close that out so we could also bring an amended CBA to you all to take action on the 24th. And so we've worked hard to get to this point. Feel really good about where we are. Dr. Shepard, I'll get it to you so we can get through this because I know many of us have 4 o'clock meetings to get to and we want to give the board time.
All right. Good evening, Dr. Bedell, Board Chair Manser, and all of the board members and community. We have a presentation here that we want to go over with you. We've tried to think through everything that we possibly could in this presentation, and we've thought through every classroom, and I do have lots of accompanying documents that maybe we won't be able to get to tonight should you need those, but I will make sure that I have them on standby to present on Wednesday night when we go over the board presentation with the rest of the community.
Dr. Shepard, technology is going to share that in just 2 shakes. They're getting ready to pull it up.
All righty. Thank you.
So I know while they're pulling it up, just so everybody knows the kind of the flow, Dr. Shepard will present. We will hear from Sarah Williams. We will hear from Lauren Grimes. We will hear from Chris Walls on transportation. We will hear from Lizelle Oldfield on the facility part. We will also hear from, I think Linda's gonna cover what we're doing with food services. So every division will be represented in here. And also for people to know, we've had a lot of inclement weather, but we've already started on a hybrid model of having employees come back to central office. So if you're driving by the parking lot, you should see more vehicles out there because we are making sure that we're doing it on a kind of a hybrid schedule. All right, can we get the presentation up? Because we got to get moving here.
We are currently working on that. There's a miscommunication regarding this, so this will be fixed momentarily.
I have it. I'll bring it up right now.
Thank you.
Actually, it's disabled, so nope, Brian's going to do it.
Yeah, I actually was trying to, okay, wait, here we go, share screen. I could.
Why we need to hurry up and get back in.
Kelly, you can share, or I let everybody else share, and I just got the email in, Kelly.
Okay, so
It looks like we're good. Sorry.
I'm sharing, and I can unshare, and we can do whatever as we move along if we feel like we need to. All righty, so just want to bring you back to what we discussed last July when we presented this plan to you. We looked at this quote here, and I'm not going to read the quote, but it gives us 2 choices, two doors that we could walk through. We could choose to walk through it, dragging the carcasses of our prejudice and hatred, our avarice, our data banks, and our dead ideas, our dead rivers and smoky skies behind us, or we could walk through lightly with little luggage, ready to imagine another world and ready to fight for it. I think that is where we are as a district in KCPS. We are ready to walk through lightly with little luggage and to imagine another world and ready to fight for it. As we look at all of the departments that were a part of putting this presentation together and making all of the decisions, we don't make decisions unilaterally. We have a Project Smooth School Start task force that meets every week. At the beginning of this, when we began in May, we would meet twice a week. We've now gone down to meeting once a week, but all of these departments are involved in the decision making because we know that at any time, any decision that we make could affect any other of these departments. And we want to make sure that we're doing everything we can to maintain the integrity of every department and make the best decisions for our students. What are the current data trends? Right now we see, and this is as of last week, we see that cases are actually trending downward. We see that deaths are actually trending downward from COVID, and we also see that hospitalizations are trending downward. Now, you may ask, are they at zero? No, they're not, and there's no number that we could be happy with outside of zero in any of these scenarios. But as we look at the trends here, we see that in each case, they're trending down. And as we look further at the disaggregation of this data, the new cases per week, we see that we had a nice spike here in the November-December time period. However, now each week we're starting to see the new cases trending down. I think it's very important for us to disaggregate this case by case and by race, because Kansas City Public Schools is composed largely of Black and Brown students and Black and Brown families. So we want to look here at what the trends are for our different race populations. And as we see here in each scenario, we actually see it trending down. And again, this is data as of last Friday, but we see it trending down here. So then how does KCPS track current data trends? We actually have our data dashboard, and it is updated weekly. And this is just a snapshot of what it looks like. And this is the website address. This is a link here to get to that data trend website. But we track this as well to make sure that we're aware at all times as we're making our decisions of where our community is, as it relates to spread and as it relates to number of new cases. Last summer, we did a survey. We conducted a survey with our central office staff, our principals, and our teachers. We had over 800 people to respond to the survey. Largely, teachers were represented. And we found the two main things. We had about 7 things on the list for everyone to choose from, but the 2 that got the most amount of votes, and overwhelmingly so, would be first, the core values for KCPS would be number 1, safety of students and staff will be foundational in all key decisions. And number 2, student learning will remain a priority and will not be compromised in either of our academic options. So as we look to bring back students in a hybrid setting, we are still assuming responsibility for teaching and learning of our students. Our recommendations are all based on several different factors. We have our health and safety guidelines that come from the CDC. We have updated guidance from DESE. We have updated guidance from state and or local agencies, agreements with labor unions, and current and available resources. So one may ask the question, has KCPS done any troubleshooting to ensure a safe return? And the answer to that is yes. As you look here at our learning centers, you see that we have taken a number of precautionary measures here and mitigation protocols. And if you look closely here, you'll see that we actually have sneeze guards on every desk. You see that we actually, our students all have masks on. This student does not have a mask on because they are drinking the water out of the bottles. We've given every student a COVID little pack, so that they will have their masks in there, and they will also have their water bottles because we're not using the water fountains the way we customarily have. So they will have those water bottles. And then you see that we have social distancing here. We actually have sanitation stations. We have nice amount of soap and all of those things that we need in order for our students to remain safe and to keep their hands and all of their everything clean. What are the KCPS instructional models for parents to choose from? So looking at all of the data that we have and all that I've shown you prior to this slide, we've decided that we're going to open up with the hybrid learning model. Hybrid means there's in-person and distance learning. So parents will be able to choose from 2 different types. We will continue with our KCPS Virtual Academy, and they will also be able to choose hybrid learning, meaning their children will come back to school on 2 days a week, and in some cases 4, and then they'll participate in distance learning on the days that they're not in school. And students who are unable to access registered courses while being enrolled in KCVA, so a parent that chooses KCVA, will be accommodated through use of distance learning support staff at their registered high school. So that would namely be some of our IB courses, some of our AP courses, and some of our electives that may not be offered at KCVA, but we want to make sure that we allow our children the opportunity to take those courses that we don't offer at KCVA. KCPS reopening phase in. So what we would like to do is on March 15th, we'd like to bring back our grades kindergarten through 3rd grade students, high minute special education students, and our English language learner beginner students. March 22nd, we'd like to phase in grades 4 through 6 and our 7th and 9th graders. Our 7th and 9th graders have not been to their campuses before, and so we would love to get them on their campus so they can meet their teachers, they can have a tour of the campus, and we can begin working with them on the things they need to know to be successful on their campus. April 5th, grades 8 and grades 10 through 12 will actually transition. And then for our campuses that have 6th grade as the beginning grade, that would be Lincoln Middle School, AC Prep Lower, and FLA. They will bring 6th graders back on this week. So instead of bringing 7th and 9th graders, they don't have a need to do that. They'll actually bring back 6th graders on this week. Our learning centers will be dissolved on February 26th so we can get our campuses ready for all of our students and our teachers to return. How will our hybrid model be executed? On Monday and Tuesday, we'll have Group A students. Wednesdays will be distance learning for all, so there'll be no one in the buildings, and our teachers will participate in the same manner that they do now with distance learning with our students. Group B students will come on Thursday, Friday. And our KCPS Child Care Partnership will still be available for those parents who need it. They are committed to continuing to work with us. And if they're the parents and the children who are there right now, if they still feel that they need support in child care, then that support will be available. Equity. Because we continue to speak of equity as a district, I felt like this was a good model, and I borrowed this from Broward County. I feel like this is a good visual for us to look at as we make the decision around who's coming back and why. If we look at the x-axis here, it gives us opportunity, the opportunity that we're providing for our children, and the y-axis here provides the equity. What is the equity, and how are we considering equity in the decisions that we're making? Where we ultimately want to be here is in this pink zone, and this is a zone of maximum opportunity and equity, and specifically in this upper quadrant here. So when we look at our model, staggered 2 days per week, all students, we see that we're pretty good with opportunity. However, when we start looking at equity, we have not totally considered equity. But when we look at this black dot here, it represents the 2 days a week plus every day for students with critical needs. And it is high opportunity and high equity. And I think as a district, this is where we want to be. We want to make sure that because we have our equity policy, that we're always looking at everything through a lens of equity. So that means that we would like to bring in we have our critical needs group that we'd like to bring in 4 days a week, but I will go over this slide just to revisit again what will happen on the different days. So then K through 3 students will begin March 15th on A day or B day. Everybody will have distance learning Wednesdays. 4th through 6th grade plus 7th and 9th, besides those 3 campuses that we talked about earlier, will begin on March 22nd, and then 8th, 10th through 12th students will begin on April 5th. And this is just yet another visual so you can see what will happen. If I'm a Group A student, I'm in person on Monday, Tuesday. I'm with my teacher via distance learning on Wednesday, and then there's asynchronous learning on Thursday and Friday. And if I'm a B group student, then I have asynchronous learning on Monday, Tuesday, distance learning on Wednesday, and then I'm in person on Thursday, Friday. So then the equity slide. This is where we will consider groups in order to equitably meet the needs of all. So critical needs here is defined as students in high-risk categories for regression of learning. Our KCPS critical needs groups are high minute special education students, beginner level English language learners, high school seniors in jeopardy of not graduating, and alternative school students. And each of these is based on the ability to social distance. So this is the priority. This is the order of the priority, but it's all based on our ability to be able to do the 6 feet of social distancing. And so they would come on Monday, Tuesday, Thursday, Friday, with distance on Wednesdays with their teachers. But we feel like these are the groups that we are wanting to provide another layer of support so that we can make sure that they are on track and on grade level. How will schools utilize mitigation strategies to stop spread of COVID? Each one of our schools was given a new booklet, and this booklet is really good from the CDC, and it was actually released. We got it on Friday, and this is just one example of what they have. There are a lot of little checklists on there so that our schools can go through and they can make sure that their individual school plans align with all of these things. And these are just some of the areas, although it's very comprehensive. This is just a snippet, and these are just some of the, when we look at the top, the different areas of mitigation that we want to make sure that we control. Availability and adherence to mask use, adherence to social distancing, clearly visible cues to maintain social distancing. All of these things, these are things that we've talked with our principals about, and our leadership team is prepared to make sure that we have these measures in place to mitigate any spread. How will we ensure 6 feet of social distancing? We have a spreadsheet with every school, and we did a study at the very beginning in July and August. Jesse Lang did a study for every single room in the building, whether it's a classroom that's actually being utilized or whether it's a supply closet. We did a study for every classroom, and it tells us here the room number, the square feet of that room, and then how many kids we could actually get in that room with 6 feet of social distancing. And we've gone through and we've done a spreadsheet, which I have available on every school. And we've looked at every classroom and how many kids are going to be in that classroom. And then we've divided by 2 to look at hybrid, and we compared that number to this number to make sure that we're below this number in every classroom and that we can get that 6 feet of social distancing. And I'm really proud to say that right now, with the hybrid return, in every scenario, we are below our capacity at 44 square feet per student. How does a hybrid day look? The daily schedule for students at school, elementary will have normal schedule in all classes every day. And the secondary was actually going to have a block schedule. So in order for us to mitigate spread, instead of them being in the hallway 7 times, we'll actually be using a block schedule when they're in school. There will be compacting the curriculum. So when the students are at school, we will actually be able to teach them 4 days in those 2 days that they're actually there. And so we're compacting it so that we can make sure they have what they need. So when they go home, they can work on their projects, the different assignments, and all of the different digital tools that we have available that were approved by you this summer. So it actually works out well for our teachers. We have cluster standards for intentional teaching, and then we're using our interim assessment data, and you received that data at the last board meeting. We'll use that to determine which students need additional support. Daily schedule for students at home and distance learning is self-directed. Students complete a synchronous task from all courses, and it's the application of taught material and introduction of material to be taught. And we actually have a lesson plan template that we gave our schools back in the summer. And this is a really great template for them to work through as we look at the hybrid model, because if I'm a teacher and I'm planning my lesson for the week, then I'm looking at how can my synchronous roll over for the students on the days that they're at home on the asynchronous day. So I want to make sure that in everything that I do, I write it, what I'm doing with them at school and what things they can do as an extension of what we did at school while they're at home in their asynchronous time. Dates to remember that we've put into place to support our teachers, our students, and our teachers. February 22nd, our principal and vice principal lunch and learn to review district safety handbook will take place. Sarah Williams will be leading that. And so all of our principals and vice principals would have an opportunity to look over our safety handbook and to talk through it so we can make sure that all of our practices are aligning. The key word for us during this season is alignment. We want to make sure that in everything we do that we have really great and tight alignment with all of the people that we're consulting with, the different agencies, plus our own district handbook. February 24th, we have a staff town hall that will involve all staff, and we will actually talk about mitigation strategies at work and at home. And Sarah and Lauren have actually been really great about scheduling the Children's Mercy to come in and to provide that training. So this training will happen on Wednesday, and all of our staff, and we'll record it, because if there are some that don't get an opportunity to see it on that day, they'll get an opportunity to see it later. So this will happen Wednesday morning, and we're still waiting on an exact time because we are waiting on Children's Mercy to respond to what time before noon that they would like to get this started. March 4th, our staff will receive PD on Illuminate, which is our tool for testing and instructional design in a hybrid model. We've already gone over this before, but we want to continue to review what needs to happen for each student when they're at home on that asynchronous learning day. And then the last one here is March 11th. Our staff will review campus safety guidelines. Principals are currently turning those guidelines in to Lauren and Sarah. And once they have reviewed them and approved them, they're giving them back, or if they have to ask any questions or principals have to make any revisions, they're being given those campus safety guideline booklets back so that they can do that, so that here on March 11th, they can be prepared to go over those campus safety guidelines with their teachers half the day. And then the second half of the day, our teachers can work in classrooms. We did give them time at the beginning of the year to set classrooms up, but we know some time has transpired in between that time. And so we want to give them more time to go back in their classrooms and do what they need to do in order to prepare for our students. This is I'm not going to read this, but this is the principal's checklist. We gave this to principals so that they could be prepared. And many of them have worked through the majority of this. And so this is these are just steps and things that we want to make sure we have in place so that as we proceed, we can give everyone the assurances that we've done everything that we possibly could to educate and ensure the safety of everyone. And as you see here, our principals will have safety procedures and protocols town hall with their students, and they'll also have one with their parents so that parents can see what those safety guidelines are. And they have up until the day before the children come back to do this. So the children return March 15th. Our principals were given instruction that they can have these town halls anytime up to that date. And then these are just measures that we're taking for mitigation of COVID spread within schools. And these are the things that we had in place right now when we did our learning centers. And these are things that we'll continue to have in place. Now I'll pass it over to Lizelle Ophil, and he will talk about some of the other safety measures as they relate to air quality.
Thank you, Dr. Shepard. All right, so I will begin. As we started our work, we worked with the CDC. Can everyone hear me? Yeah. Okay, thanks. We worked with the CDC. They rolled out a readiness and planning tool assessment that we use for each of our buildings. And so part of that tool was looking at our airflow and our air quality. We partnered with Accutech to survey all of our buildings to check our airflow. With their recommendations, we made those necessary adjustments. Some of them included in upgrading our filters to MERV 10 or above. We also identified isolation rooms in all of our schools, and we've placed standalone filters in those rooms as we house sick children in our isolation rooms. Next slide. Thank you. And along with this assessment tool, we looked at our procedures as we clean our buildings. We looked at our staffing. We looked at the chemicals that we're using. We looked at the soap supplies for each of our facilities. We wanted to make sure that the classrooms and the teachers will be well prepared to self-perform. In their classrooms, we provided our cleaning products along with paper towel dispensers so the students and teachers can self-perform cleaning their desk areas after their lunch periods, or any activities within their classroom. We also looked at their trash cans because we know a lot of our classes will be eating inside the classroom. So we purchased larger trash cans to accommodate their trash flow, and that will be picked up during the day from our custodial staff. Next slide. For our personal protective equipment, we identified what would be our standard for our district, and wanted to give a huge shout out to our partners and local businesses. They have really stepped up and helped us out with providing face masks, face shields for our school districts. So in the safety kits, we're giving our kids on the first day of school, they will get 2 face masks, a lanyard to keep the face mask on their person in case it falls off. They will receive a water bottle so they can refill their water during breaking periods, because right now our fountains are off limits for our normal regular use. And we've also identified safety kits for our staff. We wanted to keep them safe. We wanted to provide them with a face mask, a face shield, and a small bottle of hand sanitizers, and each staff will receive that on their first day of return. Next slide. And I'll turn it over to Chris Walls, our transportation.
Thank you, Lizelle. Good afternoon, ladies and gentlemen. For transportation, we're going to look very similar to what we've looked in previous years, except for a few areas, and I'm going to kind of highlight those. The areas that are going to change for us with COVID, we're going to look at loading, unloading, and seating assignments. So we'll work through that here in just a second, then contact tracing, and then PPE last. So when we start with loading the buses, we're going to load all buses from the back to front. This should limit the interactions of the students passing down the aisleway in front of one another. We're also going to take that and have assigned seating from day one. So we will set the bus routes based on who's the first pickup. They're going to be in the back of the bus. Then upon arrival at the school, we will unload front to back. So we're trying to limit those passing opportunities between students. We're going to limit 1 student per seat. If we have a situation where we're not able to do that, we'll figure out what our process needs to look like so that we can be as safe as possible. But in most situations, we're going to be 1 student per seat, and siblings or students that reside together can share a seat. I think if you're in the same home, sharing a seat is probably okay. Next thing we're going to do is we're going to use our student ID cards to use our tap on, tap off technology on our school buses this year. So as a student passes by, just like we use for our staff employees now, they'll be able to use their badges. It will be able to tell us what time they stepped on the school bus. And then if they tap it when they leave, it'll tell us down to the second what time they got off the school bus. So that will help us if we have a situation where we've got a student that's potentially exposed to COVID or somebody that needs to quarantine. Also is going to help us when it comes to making sure we got the right student on the right bus. In the afternoons, if we need to know what time somebody got off because they didn't go home, we'll be able to tell exactly what time they got off and where they got off. So really excited about that this year. And then the next piece is our PPE. Face masks are really going to be essential for us in these environments. A school bus is a very limited space. And so our students are going to be potentially exposed at a higher level on a school bus than they would be in a classroom. So drivers are going to be required to wear masks. We're going to strongly encourage the students to need to wear masks as well. For students that don't have masks, we'll provide disposable masks upon entrance to the school bus. And if we've got a student that for health purposes cannot wear a mask, we'll deal with those on an individual basis. Next, our school buses will be disinfected between every single bus run. We're using a disinfectant spray that needs to sit for 5 minutes. So we should be fine once the buses are done at the school building. They will disinfect their buses down, wipe them down, and then proceed on to their next run. That way, every student that boards a bus is going to board a clean, sanitized bus and have the same opportunity as anybody else, that they're not going to be exposed to somebody else's germs. And then last, we've got hand sanitizer pump sprays that we're going to put at the entrance of the bus, so you can use when you get on, you can use when you get off. That's not a requirement, but it is strongly going to be encouraged that our students use that. That will kind of be maintained by our drivers. A student won't be kept off the bus for temperature or anything like that. We're not going to be doing checks on the bus when they get on and off. I think that's too much of an issue. We want to get our students safely to school where they're going to be doing those things. And if a student doesn't have their ID card, our drivers are going to be tracking this year who gets on and off, because that student tracing is going to be really, really critical. Outside of that, it's going to be transportation as usual for the students and the staff. It should look very similar. And our drivers are excited to get back to work.
All right.
Good afternoon, board and Dr. Bedell. I am a very poor substitute for Jordan Gordon today, who unfortunately is out of town on a family emergency. So I'm going to give you my best piece of information on this. Basically, our K-5 classrooms are going to eat all meals in the classroom. And that way we are able to really contain that passing and interaction, keep the group small, the cohort small. Our middle and high schools have alternative eating locations if the cafeteria is not large enough to sustain social distancing. We've just identified plenty of space to do that. But you can see here that we have very detailed plans on the breakfast model. Again, sack breakfast in the classroom for elementary and largely for high schools. We're going to be able to sack, grab, and go. And we have barriers set up to make sure that the staff and the students are not breathing on one another. And then you can see down below that they're going to manage the stations and record meals as normal. So this will be normal with the exception of grab and go. Next slide, please. And then again, the lunch model, the principals have been working with Jordan for months. We've gone through this a few rounds with each individual building to figure out what works at each building. So there is a plan for lunch time and for breakfast time that reduces the number of children coming into the cafeteria, if in fact that's the model that we're going to the cafeteria. There'll be seating charts so that we stay very tight cohorted and we know who's with who. Great processes and organized plans on how kids get to the cafeteria and how they take their seats and how they go through the lines. And I am not sure who I'm turning this over to.
Lauren, I believe.
Yes, that would be me. Good afternoon, everyone. Just an update on staff vaccinations. We are working with Truman and the Kansas City Health Department to vaccinate those staff members who fall in phase 1B tier 2. So we're trying to get them in right now. We've sent out communication to staff to have them let us know if they fall in that category so that we can contact them directly to let them know of opportunities. We're also working with Truman and Children's Mercy and Kansas City Health Department to ensure that when vaccine is available for tier 3, or excuse me, when the state opens up tier 3, that the vaccine is available and we're ready to go. We've secured locations at Paseo and Manual to perform these vaccinations, and the KCPS nurses will be assisting with the vaccine administration. Vaccinations are going to occur on by schools so that we can have the day of the vaccination and the day after will be asynchronous learning so that teachers can attend the vaccination clinic and that they can rest if they're not feeling well the next day. We're continuing education on vaccines with learning modules, information's on the website, and upcoming town halls for staff to utilize. Whenever we're encouraging our staff also when they register to let them know that they're with KCPS so that that kind of puts us in a priority for our partners.
All right, so who's up now, Sarah?
That's me. Hi, Dr. Bedell. Hi, board. How are you all today? Just wanted to give you just another quick on detail on vaccine, and that is the Missouri Department of Health and Human Services just opened up an avenue to where if you feel like your group needs to change to a different tier and phase, that you can apply to do so, which we did this afternoon. So I'm awaiting to hear back to see if we can get vaccine a little bit quicker for our tier 3 staff. We're working very diligently with Kansas City Health Department to identify immediately now, because they have vaccine that's available, our tier 2 staff, to get them in as quickly as possible. Just wanted to let you know, just anecdotally, I've gotten some wonderful feedback on my COVID coordinator email regarding vaccine, and just a lot of thankful staff that we're being very proactive in securing vaccine for them, even though the state has not just yet released it to our tier 3 staff. One of the things that allows us to be able to open now, which we couldn't before, is the change in our CDC guidance that we received on 2/12/21. We're really pivoting away from our gating criteria and what that looks like. When you look at our numbers, and if you look at our numbers, how they are across the metro, and our gating criteria that we were using, we're in a red zone. But CDC has told us, based on their studies that they did in Wisconsin and other areas, that you can be in a red zone and still open safely if you consistently practice your layered mitigation strategies. So your ands, right? So we have consistent mask wearing, frequent hand washing, sanitizing, that 6 feet between students and keeping cohorts, working very closely with Kansas City Health Department on contact tracing, quarantine and isolation for those times that we have a positive or presumed positive case, doing our cohorting hybrid schedule. I know hybrid isn't everyone's favorite, but it's our way that we can assure families and staff and students that we're coming back in as safely a mode as possible. The idea being that we can always open up more, but if we were to get a COVID case in the school, I think it's really going to be critical that we open up slowly, so that way we're developing that trust of our staff and our students, our families, our stakeholders, and not be in a position to where we have to immediately close. We really want to build this out to where we are able to open and stay open. And we have done some fabulous work here to get us to this place. I can tell you that as a COVID coordinator for the district, I am comfortable with our ability to open at this time. I know it can seem daunting and scary, but we're ready. And so if there's any questions or concerns that you have, I'm happy to answer them. A couple of other things I just wanted to hit on is just testing that's available. We have the Bionex Now testing that's available for all schools. We have ample supply of that at each of our sites. So and those are for asymptomatic cases, either staff or student. We are currently working with Children's Mercy and have identified their campus off of Broadway to be a place where if there's we have a concern with the Bionex Now test, let's say that it comes back as a negative, we think it could possibly be a positive based on symptoms, we can send a kid over or a staff member over immediately, and they can get that PCR testing. So we're very confident in our position moving forward. Feel very comfortable that we can keep people as safe as possible and as safe as anyone can in this pandemic situation at this time.
All right, so Ms. Williams, if you could, or Lauren could do this, just quickly update. We have a good number of faculty and staff members listening in on this. And I think it would be important to also share with them regarding the testing of our athletes and what those results yielded.
Okay, yes, so we randomly tested our winter athletes. 152 athletes were tested, and 152 athletes were negative. So this was very, very promising to show that, and especially with the younger children, well, these are high schoolers, but still very often they're asymptomatic, or their symptoms are so mild that they don't even realize they're having them. And so it's easy for them to overlook. And we were able to show that none of them had COVID.
All right, thank you. So our last presenter will be Kelly Waitcher to close this presentation out and then open it up for questions.
Thank you, Dr. Bedell and board. So as we talk about all of the information that we're giving you right now, how do we package that and make sure we communicate it thoroughly and succinctly to our community? These are a running log of items that we've been doing and will be doing as we communicate our reopening plans. We are in constant communication with our staff and families as the board and administration make decisions on our reopening. We have been looking at internal for our staff and external for our families and community and media as well. We've been doing informative videos. We're looking at testimonials from our teachers who are currently in person and teaching with students in their classroom from our learning centers, from our Head Start programming, to really give other staff comfort in how they've approached this year since the fall being in person with our kids. So we're looking at having our teacher testimonials be ready for our staff next week and for the board next week during our board meeting. Dr. Bedell has done Facebook Live events where he walks through how we're going to reopening, how learning is going, and we envision him doing that as well as we get into next week and the following weeks prior to school starting on the 15th for our kids. As the team mentioned here previously, it's important for our staff to feel comfortable in those town hall Q&As with our medical professionals to get questions answered and look at mitigation strategies for at home and at work. And then for our families at our school levels to hear from our principals and staff as they get ready to come back, what's happening at that school level, and have parent questions answered during those town halls or open houses at the schools prior to school starting. You heard some vaccine education that's going on. We still have our Meals on the Bus communication, our parent universities happening in this digital environment. We have our trauma sensitive clinicians available and also available on our website. And then we have our COVID dashboard that Dr. Shepard mentioned, again, tracking all of the cases and resources available for our families. This slide shows, again, examples of the communication we have been conducting throughout this reopening and distance learning process, from our communication to our videos in conjunction with Truman Medical Center and Children's Mercy, to our Facebook Lives, to our social media, and to our parent universities. And then the last slide here, there's two more slides. This slide shows our website snapshots of all of the resources we have available for our parents and for our staff, from our dashboard to our plans, to our teaching and learning, to health guidelines, FAQs, nutrition services, childcare, device support, and then again, this COVID dashboard on the right-hand side here showing positivity rates within our KCPS boundaries. And then this last slide here is the guidebook that we're currently working on. We know we have lots of questions from our staff and from our families about how we will address protocol, procedures, mitigation factors. This about 38, 40-page document will be posted on our website next week for our staff and for our families. This is the table of contents that shows all of the topics we will address more specifically and more layered for people to view and to get more specific information. So this guidebook hopefully will answer some of the more specific questions that, again, families and staff may have. And that ends the communication portion.
Okay, so Madam Chair, we will open it up for questions at this time. We have about 15 minutes remaining.
Fantastic. I'm going to have my board colleagues wave at me so I can see you. There's Miss Wolfsey. Go ahead, Miss Wolfsey.
I feel if someone else wants to go first, please,
Well,
I'm always the one. Okay. Okay. And first off, apologies, guys. I had technical difficulties getting on, and it wasn't you guys. I think it was me, user error. But if you have already answered this, just say so. First off, thank you so much for the completeness of what I was able to see. It is clear that you are actually, the mitigation strategies, the layered ones that I talked about before, I see them. I can actually understand them. I appreciate it particular. I think it was Ms. Williams' explanation of why now we're able to move out of, why we're using, instead of gating criteria with the CDC's new guidance on some of the research they've done, how they are changing their guidance. So with that said, I know a number of families and probably teachers and staff will be more comfortable moving into the buildings. However, we will also have families that, even given all of the information that you have presented, who are currently in distance learning, who have had those teachers from the beginning of the year and those programs. If they do not feel comfortable returning to the building, even with everything you've put forth, what are their options? Are they going to be asked to move into virtual, or can they remain in distance learning at home?
All right. Dr. Shepherd, you want to answer that? I mean, we did talk about that at the very beginning.
Sorry.
So every, we have two models. We have hybrid and we have KCVA. The distance learning model will be for those who are enrolled in a class that is not offered in KCVA. And so if there are students who are taking courses like IB courses, AP courses, or some of our elective courses that are not being offered at KCVA, then we do have an arrangement to provide learning and to provide instruction for those students.
So thank you. I think I understand, but I will raise the issue of equity. So what that says to me is a student who is in a neighborhood school, be it elementary or secondary, if that program is offered in VA, they are going to be asked to leave their current teacher and environment and have to go through the change process to switch to VA. Is that correct?
Yes, they will.
I'm just going to be honest, I have a bit of an issue with that.
But Ms. Wolfsey, we talked about this back in August, that those were the two options.
We also talked about gating criteria that were a lot different in August. Things change. And I do have I'm just going on record as I have a concern with asking students who I believe actually might need that consistency more than some of those IB or AP students. And I know everybody needs consistency, but I have a real issue with it. And we don't have to fix it. This is a reopening plan. I don't want to take any more time. I just want to register my concern about that.
Next question. I just want to ask a question, then I'm going to wait. My colleagues, you'll have to wave at me, and I see Dr. Jones. I'll go ahead and ask my question. Somewhat related to Ms. Wolfsey's question, part of what we're trying to do is alleviate fears and concerns and the sense of safety. And because we're really rolling this out for the first time, families haven't had enough opportunity to sort of absorb this information. So what kind of additional coaching and support might we provide to families that might help them overcome some of those concerns and fears? It may be that some families, regardless of that engagement, will still feel not equipped, but there may be some avenues to address some of that uncertainty at a more personal level. What are the mechanisms available to sort of coach and work with families at a more personal level to see if we can alleviate concerns?
You want me to answer this, Kelly?
I'm happy to answer that. So yeah, as you saw in the presentation, from consistent communication, video work, testimonials with our staff, town halls, parent open houses at each individual school, and information available on our website and through communication, Ms. Manser, I think, we have a group of principals and leaders here who go above and beyond to work with families individually as needed. And I really hope that we will have families who want to talk more individually reach out to their principals, to their teachers, to be able to share concerns, thoughts, ask questions on that individual level. We're always open to having those personal one-to-one conversations. I would also say that we have, again, a wealth of information available as resources on our website through communication, through our new Talking Points app that we've rolled out in multiple languages. Lauren says from their nurses as well. Our nurses have been doing professional development throughout this whole pandemic to make sure that we equip them with the talking points education necessary to visit with families as needed. So I will say that as a quick answer. Dr. Badal, if you have any additional thoughts about that.
Yeah, I mean, I think you hit it on the head, and I know that many of our building principals are already having those conversations with parents as they're working out their individual plans. I think it's important that we remember that the district has a full-blown, we shared with you on the last slide, the 38-page document that kind of guides everything, but then individual schools also have to have their unique plans and their unique systems. And that's part of the conversation that they'll be having with their respective, community also.
Dr. Bedell, I'm going to go ahead and turn it to Dr. Jones and then Mr. Abarca after that.
Yes, thank you for this. And one of the questions that I have is, kind of aligned with what Ms. Woolsey was asking, and some of the questions that I know people have been bringing up about how do you teach kids who are both students who are present and the ones that are out. So from my understanding, they're going to be switching on the AB model for the most part, but is it that those few set aside to teach like the electives or the IB or what have you, are those students, those teachers would be teaching both in person and virtual? Is that the correct understanding?
So what we're doing is we are actually going to get some paraprofessionals to provide support, and it's for any, not just our signature schools, it's for any high school, any course where students have a need to take. It could be a business course, but we will have paraprofessionals in place that will actually have the electronic device so that they can make sure that those children are actually able to get what's needed. One of the things that we found as we've researched across the country with how it's being done is that it places an extra level of responsibility and stress on teachers when they have to be responsible for children who are at school and children who are also on the computer at home, because many times they have questions and there are a lot of things as well. So we're looking at how do we create the best scenario for our teachers. However, we feel like if we get paras and we actually have additional funds, because we have not used some of our funds that we had slated to be used this year, that we could have a person that does it for certain classes if those students desire not to return to the building. And so that's our way. And when we think about equity, we are doing this equitably, because any parent or any student, wherever they are, if they can, if they have need of additional support in an area that's not offered at KCBA, then we will do what we can to accommodate them. And every student also has an individual learning plan. And so we've told principals, we know that we've got some seniors and we got some juniors that are not on track. So we've given them the latitude to do some things that they feel like they need to do in order to make sure that those students are able to get across the stage. And so we're working with our schools on this, but we are looking at how do we keep the stress level down for our teachers. And based on best practices across the nation, we've gotten lots of reports that this is just not a best practice and teachers are not doing very well with being responsible for two groups of children.
All right, chime in very quickly before I have a coughing fit. One quick statement. This is an incredible plan. Thank you all to the level of extent you've gone to make this plan ready for us at this point. And this is not our fault. This is the failure of the governor and so many more folks to plan for this situation. So we're just reacting here, and I very much appreciate your all's professionalism in this. I want to inquire about the quarantine requirements for staff and how that may have changed a little bit, because I know a lot of times when opening happens, and if there is any type of exposure, it was the staffing that was a major component as to why there was closure again. And those were very different times, but I think it's also important for us to understand that component and to understand more if there's going to be random testing like we did with our athletes last fall going on in our schools for our students and our staff.
All right, so I'll pass that over to Sarah around, our system with quarantine and how we operate and work with that. And then we can move it over to Lauren on the testing piece.
Board Member Abarca, you may need to go get tested yourself, but so just to let you, oh bless your heart, just to let you know that we do have our contact tracing quarantine and isolation program down cold. We're also having, now that we're going to be in our buildings, our nursing, our Lauren Grimes staff is working closely with her staff to turn that over on the building level. We realize that staffing could be an issue at some point in any given building, just depending on how well our mitigation strategies are going. We expect them that they'll go well. We're prepared. We're educating our staff. We're educating our students on these issues. So as far as isolation and quarantine, that has changed at this point, Board Member Abarca. The only thing that's really changed is for those folks that have received vaccine. So if someone has received vaccine, now they don't need to quarantine if they've had close contact with someone who, a close contact exposure with someone who's had COVID. Otherwise, Kansas City Health Department has instructed us, because of our numbers as to community spread within the city, we are still at a 14-day quarantine for folks that are in quarantine. It's 10 days for isolation. I know that's, trips people up sometimes, but that's just because, you already know you have it, so you're isolated for 10 days rather than, I don't know if I have it, so you have to stay home for 14. So that's where that is. It's been successful with our learning centers. It's been successful in our pre-K program. It's been successful with our essential staff. I can't tell you we haven't had cases, but I can tell you that as soon as we know, we move immediately for isolation and quarantine measures, and we get that information out and communicate it to staff as quickly as possible, which we will continue to do with staff and families and students as we go forward.
And then let me answer that second question, because I think what you're saying is, yeah, we absolutely can do the random testing if we have it in stock. We can do that with athletes, but I think as far as the regular student population, that would require a consent from parents.
And that's correct, Dr. Bedell. And if I could as well, I just also wanted to let you all know, I am working with Children's Mercy right now to establish a testing protocol for our schools that are in the Northeast corridor, which are our zip codes that have high numbers of transmission, more than others. So we're working through that. It's just a matter of where money meets I don't know what you would call it. Where money and ability collide is what we're looking for, and we're working on it to get that rolled out before March 15th.
Ready to help you with the.
All right, so I want to just pause for a moment. I know it is 4 o'clock, and I want to make sure that if Ms. Cortez and Mr. Hogan have a question or a comment, I want to give them that opportunity. And Mr. Wasserstrom, if we could do this quickly, thank you.
Yeah, I'll be super brief, Madam Chair. So thank you for the update here. I think it was absolutely it felt more complete, let's just say it that way, than previous presentations on this topic. And I know there's a lot of moving parts and pieces that you guys are trying to bring together, and so appreciate the thoroughness of this one. Look, I feel like we're ready. I feel like the science is clear if you look at it across the country that these are not super spreader events and people can be safe if all the mitigation strategies are consistently adhered to. And so there hopefully is going to be a tremendous amount of focus on that. I'd like to walk through schools as soon as we start and just experience it and see it. So I'll get a request to you on that, Dr. Bedell. But the question I have is, look, I don't have to actually go and teach, right? And so I get where teachers are at with this. So I would just say, let's continue to keep close to them, hear their feedback, adjust where we're able to, et cetera, because they're going to be at risk more than anyone else as a result of this. And so let's just keep them close and make sure we're supporting them.
Thank you. I agree. Ms. Cortez.
So I echo all of my colleagues in expressing gratitude to our administrative team for the clarity that you've laid out today. The one thing that I would encourage you, it's kind of a follow-on to Ms. Wolfsey's comment, and it's really to explore or to challenge whether in, narrow or very limited circumstances, we can work with families who for a particular reason can't or allow their student back in or don't, and whether that can be accommodated in some kind of an asynchronous manner as opposed to a synchronous manner. Whether it's having teachers record their class and make it available, or, I know that Dr. Shepard, I hear you loud and clear. I know that I've done a lot of reading on the topic as well. And most districts do report that synchronous multi-strategy learners does not work very effectively and puts an incredible stress on the teacher in that situation. But if we could explore asynchronous options, I think that would be something I'd really encourage.
And Mr. Wasserstrom, do you have any questions or comments you want to make? I know that the staff is ready to, it's going to have to leave. Mr. Wasserstrom, go ahead.
Yeah, it's okay. I've heard enough.
All right, thank you. Dr. Bedell, I think one of the things that we'll want to discuss next Wednesday, and board is encouraged to submit additional questions for next Wednesday's discussion. One of the questions we'll have is adequacy of subs, if we have enough subs, if we have to go into a quarantine situations, and how we will reallocate staffing. And then another question I think I have is, how might we use other, beyond paraprofessionals, other groups like City Year and others that are available to us within our schools, but that can wait until next Wednesday. I think was a very good briefing for us. It was, I know, very short and tight, but I'm grateful to the administration. Please, board, submit your questions for next Wednesday's discussion. For the community who are here today, we encourage you to join us for our board meeting on next Wednesday. That meeting starts at 6:30 p.m. and that meeting will include a more thorough and less rushed discussion, but this was a very good start and rollout. Thank you, Dr. Bedell. I'll let you make any closing statement.
Yeah, we will 100% do everything in our power to respond to the questions, and I think everybody just has to understand we're not going to enter into March 1st or March 15th and everything's going to be 100% perfect. That hasn't worked for any system that I've been talking to around the country that have brought people in. Will we find ourselves possibly in situations where we have to close classes down? That's a possibility. Or close a school down? That's a possibility. That's why it's important that we continue to have the resources that we need, that if we are finding ourselves in that position, we're going to still be able to conduct schooling. But we think at this point, it's just important that we do everything in our power to do what we need to do responsibly so that we don't have to find ourselves in that situation. There are a number of districts around the country, and I'll use Omaha Public Schools as an example. Their data is not that far from ours, and people haven't been vaccinated yet, but they have a very tight system in place from a mitigation standpoint that is allowing for them to be able to have school and have it without a bunch of interruption. So that's what we're trying to minimize, is the interruption that this could bring on folks, but we all got to do our part, and the district will do everything that we can to make sure that the adults in this organization are protected. You will see that on the first day when everybody is back on the 15th, when you do tours of these buildings.
Thank you, Dr. Bedell. Thank you to my colleagues for making time for this briefing today. Again, please submit your questions in advance, and we will have opportunity for a deeper conversation next week on Wednesday. So with that, I'm going to go ahead and adjourn this meeting. Thank you.